So to continue, they are given instructions on just like follow-up medications, wearing a nighttime eye shield for that after having cataract surgery. And so the next one is retinal detachment. And that is, so this is our last one. The area affected is the retina. And there are many cases, but the most common is the retinal break. And it's referred to as holes or tears of the retina. So it can be spontaneous, or it can be due to old age because of the vitreous humor shrinks and then it pulls on the retina. So the risk factors for this disorder could be increased age, severe myopia, eye trauma, cataract surgery, genetics, and then also from having a past history of retinal detachment. Just because if you have it in one eye, there is a good chance you can have it in the second eye later on. So clinical manifestations would be patients with a detached retina describe symptoms of light flashing, floaters, cobwebs, a ring in their line of vision. And then once the retina is detached, then the patient will describe like a painless loss in their central vision and their peripheral. So it's almost like a curtain is falling down in their line of sight. If the detachment is smaller, sometimes patients won't even be aware of vision problems at all. So it's good to see a doctor for regular checkups. For diagnostic studies, they would assess the patient's visual acuity and then loss of vision, and use the ophthalmoscope and then the slit lamp microscopy to view the retina. And then they could also use an ultrasound too, just to identify it if the retina can't be detected the other way. So treatment would be, it's important for treatment because there is a 25% chance that if you have it in one eye, you can get it in the other eye. And also patients who leave it untreated are at risk for blindness in that one eye. And then so treatment and management therapy is laser photocoagulation and then cytopexy, which seals the retinal break by creating inflammation response with a laser to cause corneal retinal adhesion or scarring in the area that seals the break. There's sclerobuckling procedure, which involves a silicone implant that is placed again against the sclera to cause the sclera to buckle inwards, and then that and it facilitates that contact between the sclera and then the retina. There's also vitrectomy surgery, which is the removal of the vitreous that is pulling on the retina with the old age. And then there's the intravitreal bubbling, where gas is inserted into the vitreous and of the eye to form a temporary bubble that closes the retinal break. So nursing managements for those would be that patients would need to remain in the hospital for some of those procedures for several days, and then they required the need for multiple eye drop medications involving antibiotic, anti-inflammatory agents, or dilating agents. So patients going through the intravitreal bubbling procedure will also need to be informed that they'll have to position their head in a certain way during the surgery, and then sometimes for several weeks after the surgery as well. Other nursing interventions would be the fact that the retinal detachment often requires immediate surgery. So patients who weren't expecting surgery could feel a little anxious and just overwhelmed about having that immediate surgery. So help that would be part of the nurse's responsibilities. And then also patients can complain of pain after surgery, so just instructions on pain medications, the regimen there at discharge, and then also since patients are at risk of having it happening to the other eye, it's just letting patients be aware of signs and symptoms to watch for, and then also just promoting protective eyewear too, just from any trauma or that can happen to the eye, to create that disorder in the other eye. And then that's it. Thank you so much.